So if I look here for this patient, there's been some confusion and he's been driving, but he also got lost while he was driving. It looks like he's also got diabetes. He's also had some high cholesterol. He is a smoker. And has been a smoker for the past 50 years. So
you're looking at multiple risk factors there in and of itself. And I'm guessing when we look at risk factors, you got his age, which is non-modifiable. I think look at his family history, see if there's any genetic link to any memory issues. Once again, non-modifiable. But then you've got multiple modifiable risk factors there. So we've got diabetes, so any long-term metabolic health could lead to it.
And so when we talk about modifiable and non-modifiable, it seems relatively obvious, but non-modifiable would be the things I can't do anything about as a doctor.
It's just,
or as a patient.
Anybody. It's right? Just there.
It's
you
there.
Can't do anything about the age. Can't do anything about genetics.
I can't control who my parents are.
No.
And what their genes were.
No.
But modifiable are the things we can help with.
We
things that we can do.
We have somewhat control over.
Yeah.
Yes, so. And like with that, all right, so we talk about metabolic disease, you've got diabetes there, so keeping a tight control over blood glucose, following a healthy Mediterranean diet, that usually helps in that regard.
So when you say Mediterranean diet, I want to be real clear that most of the time when people think Mediterranean diet, and I will tell my patients, follow the Mediterranean diet, they think I mean go get a gyro, in South Georgia we call them gyros, not euros, and that's a Mediterranean diet, or hummus, you know, and that's a Mediterranean diet. But that's not really what the Mediterranean diet is.
No. We're looking more at a whole food style diet. We're looking at fresh vegetables, fresh fruit, fish, lean chicken, limiting the amount of red meat to maybe once per week, non-fat to low-fat dairy products, nuts, basically trying to stick with whole foods, natural foods, and staying away from this ultra-processed stuff that our society is just littered with. And doing that, and when we talk Mediterranean lifestyle, I'm not just talking about the diet too, I'm talking about being more physically active, because physical activity greatly improves perfusion to the brain, so blood perfusion to the brain. So getting in 150 minutes of exercise per week on top of eating a whole food diet. Those are, and that will help with all the metabolic disease, or should help with the metabolic disease, as well as prevent dementia. But you listed in there high cholesterol. Statin therapy sometimes can be linked to some types of these short-term memory issues. So that's another risk factor we have to look at when we talk about medications. But
and that's a hard one, because it depends on which study you believe.
That complicates matters.
Because the statins are good for microvascular circulation, but then there has also been some question, especially recently, with if we're reducing the cholesterol too much, where we are. And I think this is a great place for physicians and providers to step in a relationship with their patients to say, here's how we're going to proceed.
Exactly.
And not a cookie cutter, one size fits all approach. Because
it's a complicated issue.
Yeah.
It is. We look at sleep also. We brought it up earlier. I would definitely want to look at this gentleman's sleep. Ask his wife, has he been snoring at night? Is he restless at night? Is he going to bed at the same time every night, waking up at the same time every morning? Poor sleep in general can lead to this issue as well.
And sometimes confusion at night, right? Like usually I don't see my patients complaining of this. What I'll see is their family saying, at night, he starts talking strange. He starts talking out of his head, or he'll say things that just don't make sense.
When the sun starts going down.
Thus, we call it sundowning.
Sundowning, that's it.
And people tend to get more confused and more disoriented. Again, I think we see evidence of this sometimes when people are driving, people are out, that they get disoriented to either time, and they kind of forget, they get their days and their nights mixed up.
You'll see hospitalizations a lot too.
So many times I'll see somebody who, when they're sick or they're ill, it'll sort of unmask some of these things that maybe has been sort of under the surface in doing that. And so as we sort of move through, obviously I don't see any medications here that he's on that could be causing this, but we obviously, as we think through for this patient, we're thinking through his risk factors.
Yeah.
We're asking some of the questions about registration and disorientation.
Is he social? Is he socializing? That's another thing. Social isolation tends to bring this out as well. Retired life tends to be kind of isolating for a lot of people, and we found that the more isolated people are, they tend to have a higher risk of developing short-term memory loss.
And so not only just social isolation from not being around people, but also people with hearing loss.
Yes.
Is another major risk factor.
Yeah, and for the amount of people out there who actually have hearing aids, the ones that actually use them is a very small percentage, and they really should be, because we've seen that not stimulating the auditory pathway in somebody with hearing loss is another risk factor, or they at least there's a correlation there between having a higher risk of short-term memory loss.
You know, I think a lot of times people ask me things like, well, what if I do some of these puzzles, right? Will this help maintain my memory? And honestly, what a lot of times I end up telling people is, doing puzzles, crossword puzzles, it exercises a certain part of our brain, and I think it helps with that portion.
Yes.
But the social interaction and hearing and sight being two of the most important things, because they're giving our brain constant input, are so important. I've also known people, right, who had hearing loss that just in my personal life that I thought they're developing dementia, and they get a hearing aid, or they get one of the guys had a cochlear implant, and like instantaneously he went from I thought he had dementia to he's back to his normal self. Now there's a difference here, right? Because before, while I thought he had dementia, he just couldn't hear me. But there is a link, if that loss of hearing goes on for a long period of time, that it does tend to lead towards a higher rate of memory loss
It does.
and a higher dysfunction. And so with this, guys, we're going through. I think my next workup would be to get some labs. I want to make sure that, again, there's nothing metabolic going on, that there's not a problem with diabetes, there's not a problem. Certain electrolyte abnormalities can
Urinary tract
infection, urinary tract, pneumonia, anything that could be sort of underlying all this. And this is all something that that we can do kind of on this first initial visit
before starting medications.
Or even go into other things like an MRI of the brain. Though at times, depending on how well I know the patient and what's been going on
and how drastic the symptoms have become. Yeah.
If it's something that's happened very quickly, and he was fine last week and this week he's not, that's something very different than perhaps a slow progress. And I think a physical exam is another great place, and we've got a lot of tools now that we can use to help sort of gauge where somebody's at, because even seeing some of these small things, right, just some computer testing, doing some small, without doing computer testing.
Just like the minimal status exam, but then you have things like the cognitive view now that can kind of ramp it up a little bit.
It just sort of spreads the bell curve out a little bit where we can see maybe where people are having more issues, and then that helps a little bit from a standpoint of if there is dementia, right? If we ruled out all these other causes for memory loss, and then we start going, okay, well, what type of dementia is this?
And that'll dictate what medications they get. But the good thing about the lifestyle modifications that we talk about, you can go ahead and initiate those after this first visit before you even get everything, because the lifestyle modifications are essentially universal for about everything.
Yes.
It's like all the things that make you healthy in life are what help prevent dementia.
Right. Well, and even like you back to the Mediterranean diet, one of the things that I've used a lot in the last couple of years is a diet out of North Carolina called the Mid-South diet, which is where they took all the principles of the Mediterranean diet and they applied it to good Southern cooking.
There you go.
So that you can have a biscuit, and it will tell you how to eat your greens and all of this. And so for me and my family, this is how I grew up eating. And so it makes it a lot easier to say, let's apply some of those principles over here, as opposed to what my dad, who always say, I don't like Mediterranean food. Okay, I need to change the name of it. So
that's it.
So I can,
it's all about marketing.
It's all about marketing. I can pull the Med South diet, which you can download most of that stuff for free. These are resources that have been put out. They're not unique to us. They're out on the internet because people have seen that need, and that's one of the areas. I think the other thing is just eating with people. And actually, if you look at the Mediterranean diet, one of the things that people don't realize,
it's a social.
They recommend at least one meal a day be eaten with somebody else. And I think that's the other thing that, one, we eat better when we're eating with somebody else. If if my family's gone, I'm ashamed of sometimes what I eat.
And it can be mindless. Mindless munching, so to speak.
I'll walk into the pantry, I'll look to see what's there, and what my kids can eat is different than what I can eat, and still feel good.